Hello all, very good morning. In today's topic we'll discuss regarding the uses and sources of vital and health statistics. So coming to the uses of this vital and health statistics, they are mainly used to measure the state of the health of a community to identify its problem and its needs. So far as we are discussing regarding the health statistics, yesterday we have seen what is health statistics and what are all the elements which were involved. So in today's topic, we will mainly discuss regarding the uses. What is the uses of this vital health statistics? So mainly they are helping us to identify what is the problem of the community and what is the health need, and also they are mainly helping us to compare the health status of the country to one another. So if you compare the present status, if you compare the country from one country to another country, so that you can understand what is the needful thing that can be implemented or it can be improved. So it will also help us to compare what is the past situation and what is the current situation. So here vital statistics means nothing but the data which we are deriving from the community. So it can be a health data, it can be a what is marital data, or it can be any kind of source which is obtained from the community. It is termed as the statistics. So vital statistics means nothing but the numbers. They are the arithmetic representing numbers which are derived from the community, means which were showing us the health status or the need of the community. So here they are also used for health administration. They are also used for evaluating the progress and success or failure of the health programs, and they are also helping us in the research. They are also helping us in the research for the community health problems. So these are all the uses. These are all some of the uses. So in continuation of these uses, we have uses of this health statistics. So what is this health statistics is saying means, so particularly if you want to know how many people are currently suffering from a particular disease, you can go for this health statistics. So with the help of this health statistics, we can estimate what are the demands of this disease. So mainly in case of public, whether they are able to do their work or not, what kind of damage this disease has done to the people, whether they are able to do their normal activities or not. So to what extent the activities has been prevented by the disease. So all this data can be obtained through this health statistics. So, and in continuation of that, to what extent the diseases are concentrating in a particular groups or in a population. So according to the age, according to the sex, according to the occupation, according to the place of residence, and how far do the above factors vary from time to time, and the effect of medical care and health services on the control of the disease incidence. So what is this saying means, mainly here, to what extent the disease is mainly coming in the people. So which age group has been affected, either the gender, which gender has been main affected, and what type of working people, so what type of working conditions are more favorable for this disease, and where the disease is occurring, whether it is pertaining to a single area or it is spreading all over the area. Nextly, so what is the factor range, so whether it is occurring in an aged person, whether it is occurring in a younger person, or it is occurring in an elder or adult person. So you will take all these things, and what kind of medical care and services can be produced to prevent or to control the incidence of the disease. So these are all some of the uses of the health statistics. Now we will see what are the uses of the vital statistics. So vital statistics means mainly to evaluate the impact of various national health programs. So these vital statistics, for example, we are taking measures to control poliomyelitis, diabetes. We are taking measures to control guinea worm eradication program we are doing. So many eradication programs were implemented. So if you want to know whether the program was succeeded or not, how can you say? So we have conducted tuberculosis control program, we have conducted sexually transmitted diseases control program, we have conducted so many health programs in the society, mainly to prevent the communicable disease. Dengue control program was started, malaria control program was started. So all these programs which were implemented in the community, whether they are having proper impact or not, how can we know? We can know when the number of cases in the community are coming down. So where the number of cases are coming down, where it can be recorded means they can be recorded in this vital statistics. So what is the use of this vital statistics here? Mainly to evaluate the impact of various national health programs, and if the if you, in case of evaluation, if you see, means if the results are not accordingly, if the results are not in a positive manner, then you can go what kind of future measures can be taking place in case of disease control. Helps to elucidate the hereditary nature of the disease, whether it is coming from the previous generations or whether it is capable of going to the next generation. So all these things can be known through this vital statistics, and it also helping in the planning and evaluating the economic and social development of the society. And also it is acting as a primary tool, it is acting as a primary tool for the research activities, because during the research time, mainly during the research, we are concentrating on the numbers there. So if you want to find out what is the health problem whenever you are trying to do the research, first of all you must have the data. So the data can be obtained from the vital statistics itself. So during these research activities, directly you can go to the persons who are affected, here you can conduct the research. So that's what it is acting as a primary tool in terms of research activities. Nextly, it is helping us to determine the health status of the individual, and it is helping us to compare the health status of one nation to the others. So these are the things that can, these are some of the uses. So coming to the general uses of this vital statistics, means mainly it is helping us to describe the level of community health, it is helping us to diagnose the community illness, it is helping us to find out solutions to the problems, it is helping us to develop the procedures, it is helping us to develop definitions, classifications and techniques such as recording and systematic sampling and using the skills, and it also helping us to determine the priorities for the health programs, and it is also helping us to find out clues for administrative action. So these are some of the uses. So it is helping us to promote the health legislation. So it is helping us to create the administrative standards of health activities. So why these administrative standards of health activities, means whenever you have the data, so whenever you have the vital statistics, so through which means to what kind of administration we can go through the society, we can meet the needs of the people. So all these things can be maintained. So here if you see, to know the met and unmet needs, so whenever you are doing the vital statistics, whenever you are checking the stats, so you can find out so which disease is met there and which disease is not met, what are the needs that to be met by the society to the community. So all these things can be known, and it is helping us to disseminate the reliable information on the health situation and health program, and the demand public support for health work, and to determine success or failure of specific health programs. So these are all some of the uses, general uses. In continuation of these general uses, it is helping us to quantify the health problems, medical and healthcare needs. So how many health problems are present in a society, so what is the medical and what are all the healthcare needs that are needed by the society. So all these things can be known when you have the vital and the statistical data, and it is also helping us to compare local, national and international health status of the people, and it is also helping us to status of the people in terms of effectiveness, in terms of efficiency, in terms of accomplishing the activities and the objectives of the health services. So these are all the things, and it is also helping us to assess the attitudes and degree of satisfaction of the beneficiaries. So it is using mainly here BEAT system. So whenever you are going and conducting the surveys, whenever you are collecting the data, so the beneficiaries means the persons who are taking the care, from them you can get this satisfaction data, whether they are satisfied or not, whether their needs are met or not, whether we have to implement the other things or not, whether the person is having healthy health status or not. All these things can be known through this, and it also helping us to conduct research on particular problems of health disease, and it is also helping us to measure the health status of the people. So these are some of the uses. What are the uses here? Mainly uses in terms of vital and health statistics. We have seen what are the uses of health statistics, we have seen what are the uses of vital statistics, and we have seen what are all the general uses. So now we'll see what are the sources of this vital health statistics. So firstly, if you see sources in general, we have census. So census means nothing but the total process of collecting, compiling and publishing the demographic, economic and social data pertaining at a specific time or times to all persons in the country delimited territory. So census means nothing but in a particular place or in a particular country, how many number of people are living, what is the economic status of the people, what is the social data. So whether in terms of time or time, so we are checking all these things in terms of census here. Nextly, registration of vital events. So as we have seen yesterday, what is the registration of vital events means nothing but how many births are occurring, how many deaths are occurring, how many fetal deaths are occurring, how many marriages, how many divorce, how many adoptions are occurring in the community, what is the legitimation recognizations, annulment of and legal separation. So all these things. So if you see here, legal registration means statistical recording and reporting of the occurrence of statistics and the collection and completion and presentation, analysis and distribution of statistics that are pertaining to the vital events. So what are all the vital events such as this deaths, births, fetal deaths and marriages. So what are the things, vital things that are occurring, they has to be recorded and they has to be reported. Sampling the registration system. So sample registration system means here mainly it is used to provide us the reliable estimates of birth and death rates at national and at state level. So it is also a dual record system. It is consisting of continuous enumeration of births and deaths by enumerator and independent survey every 6 months by an investigator supervisor. So what is this sample registration system means here? It is mainly registering what are all the deaths that are occurring and what are all the births that are occurring, and for every 6 months they are conducting a survey and it is conducted by investigator supervisor. So it is a dual recording system which is consisting of continuous enumeration. So continuously they are entering how many number of births that are occurring, how many number of deaths that are occurring. So nextly, notification of the disease. So this notification of disease, it is mainly providing us the valuable information about the fluctuations in the disease frequency. So it is also provides us the early warning about new occurrence and outbreaks of the disease. Nextly, hospital records. So what are these hospital records means? For example, if any person is getting died, if any person is getting registered with any kind of disease, or if any person is getting admitted, so this hospital record, it is providing us information regarding what is the age of the person, what is the gender of the person, what is the diagnosis of the person, and what is the time interval between the occurrence and hospital admission, and what is the distribution of patients according to the social and biological characteristics. So all these things are maintained in the hospital record. So whenever a disease outbreak comes, or whenever you want to implement any kind of health program, or whenever you want to do any kind of research work, these records are helping us. Nextly, disease register. So in this disease register, mainly we are recording the diseases in the community. So what are all the conditions? So what is the case fatality? What is the survival? So here this disease register, it is helping us to provide the follow-up of patients, and it is providing us continuous account of the frequency of disease in the community. So at what time the diseases are coming, so at what time the disease prevalence rate is increasing. So based on that we can go for the control measures, based on that we can go for the medication measures, based on that we can arrange the health personnel where it is needed. So nextly, record linkage. So this medical record linkage, it is implying the assembly and maintenance of each individual in a population of a file of important records relating to his health. So here, if you see in a community, every individual, he should be having one particular file which is having what are all the important items, what are all the important things which were going in his life that can be recorded. So this record linkage, it generally consists of what is the birth, at what age he got married, and what is the death, and what is his hospital admission, and what is his hospital discharge. So all these things will be there in this record linkage. Nextly, epidemiological surveillance. So in this epidemiological surveillance, what they are doing, what are the new cases that are occurring, what are all the efforts are being kept into control of this disease, all these things can be done through this epidemiological surveillance. So the other service records include here outpatient department, primary healthcare centers, sub centers, polyclinic, private practitioners, maternal child care centers, school health records, diabetic and hypertensive clinics. So all these health service records. These records are mainly helping us to take the data, means in the total population how many people are recognized or how many people are diagnosed and how many people are in a particular treatment and how many people need further surveillance. So all these things can be known, and what are all the favorable conditions that can reduce the disease or what are the favorable conditions that can increase the disease. Everything can be known by this health service record, so that whatever the service is provided to the community, whatever the service is given to the community can be known by the government, and when they are evaluating, if they feel any kind of need that has to be changed or that has to be taken place, it can be proper manner. Nextly, we'll see what is the environmental health data. So this environmental health data, it is helping us in the identification and qualification of causative factors of disease. So what are all the environmental factors that were favoring the disease? So this collection of environmental data, it plays an essential role in mainly to assign major problems for the future. So if you follow, if the pollution rate is in such a way, in future so many pulmonary cases can occur, means so many cancer cases can occur. So in such a way, so many new diseases can come. So in such a way, the environmental health data, so if the surroundings are clean and neat, the disease rate can be prevented and the mortality morbidity rates can be decreased. And if the surroundings are not in a good manner, if they are favoring the disease, there you can observe the disease rate increasing. So this helps us in the disease control data, mainly to avoid the problems which were coming in the future. So nextly, manpower statistics. So what are these manpower statistics? Means mainly this manpower statistics, it consists regarding the physicians, how many physicians are there, how many dentists are there, how many pharmacists are there, how many veterinarians are there, and how much hospital medical technicians are available. So these records are mainly maintained by the State Medical and Dental Nursing Council and Directorate of Medical Education. So here, if you see, for example, if you see our states, for example, if it is Andhra Pradesh, we will have APNMC. If it is Kerala, we will have Kerala registration. If it is Pune, we will have Pune registration. If it is Kolkata, we will have Kolkata registration. Means if it is depending upon the states, if it is Karnataka, we will have Karnataka registration. So in these registrations, so all these states all together, we are getting registered in the INC. Why? Mainly they want to have the resources. So how many people are available, how many doctors are available, how many nurses are available, how many dental staff are available, and how much paramedical staff are available, they want to identify. So these records are mainly maintained by the directorates of this medical education. Nextly, coming to the sources of this vital statistics, we have health surveys. So these surveys are carried out for the epidemiological diseases. So mainly, what is the incidence and prevalence of the disease and what is the situation in the community, and it is also helping us to study the merits of different methods which were adopted during the control of the disease. So these are the health surveys. Nextly, records of hospitals and health centers. So as we have seen earlier, so mainly they are maintaining the birth records, they are maintaining the marriages records, they are maintaining the death records in the hospitals, and they are also this data is also used for the demography and public health practice. So this data is mainly collected at local, state and national level, and it is analyzed to assess the changes in the disease situation mainly in the community. So here, if you see, the records are maintained as routine in registers over a long period of time for various purposes. So mainly, what are the various purposes? Means we were mainly checking the vital statistics like what is the birth, what is the marriage, what is the death rate in the hospital. So all these things are coming under the records of hospitals and health centers. Nextly, sources of this health statistics, mainly we are getting from the medical and health institutions. So what are these medical and health institutions? Means here, so the persons who are getting admitted into the hospitals or clinics or dispensaries or maternal child care centers or diagnostic laboratories or mass immunization centers or medical care programs. So from all these areas we are getting the health statistics. So these statistics provide admission to the hospitals and other medical institutions. Nextly, surveys. So why these surveys are conducted? Means mainly they want to take the response and need for more detailed information. So based on the geographical basis and to do the nutritional surveys and epidemiological investigation in various diseases. Nextly, physician's care. So what is this physician's care? Means mainly the records and police reports on accidents affecting the health of the population. So whenever there are accidents that are occurring in the community, they has to be registered in a proper way, so that we can estimate, so what are all the traffic rules can be implemented, what can we delimit, what at what speed if you go, the rate of these accidents can be prevented. So all these things it can be coming. Nextly, journals. So journals have periodic publications about the vital events. So this is regarding the uses and the sources of the health and vital statistics. Thank you so much for listening. So if you like the content, please like, share and subscribe the channel, and share it to your friends also. If you have any queries, you can drop them in the comment box. Thanks for the support. Thank you so much.